Kate, as an OCD therapist, what would you wish other therapists knew about OCD?
I wish other therapists, first of all, received training in OCD. Graduate programs and other advanced training programs tend to not talk about it much at all. And so that would be the first step. And as part of that, I would hope that they would learn what OCD isn't, because OCD is portrayed in media as either the boy who couldn't stop washing, that old book, or Adrian Monk on the TV show Monk, or Jack Nicholson in As Good as It Gets. And those media presentations of it are not usually what OCD tends to actually present as.
Can you talk a little bit more about what is OCD?
Yeah, OCD has a whole bunch of different disguises it wears, or sometimes I use the term flavors of OCD as well, because it's not important to necessarily cut it really finely about which subtype it is, but it is important to know that if somebody shows up with stress because they're trying to be a perfect student or a conscientious environmentalist, those qualities could actually be there because they are trying to calm down or tamp down intrusive thoughts that are telling them something very much the opposite. And somebody can also come into therapy thinking, what if? That's like the classic piece of anxiety and OCD, right? They're trying to answer an unknowable question. And so what if I'm actually straight sounds like a really meaty question for a therapist. Or what if I'm actually harming people and don't even remember it? Oh my goodness, as a therapist you might be thinking, whoa, is this maybe psychosis? And this is a really important thing to figure out what's going on. Where addressing it by doing an assessment for OCD could actually be a pretty fast and non-harmful tool to get a picture of what's actually going on. So using a tool like the Y box to give more context to the presentation that somebody's coming in with is really useful.
That's a really good point, because if it is OCD, or the therapist could spend hours and hours, sections, talking about insights and talking about the what if, when actually could be ruminating and not helpful for clients at all if it is OCD.
Yes, because insight about how you're managing your OCD is very different than insight about the content of the OCD. And we don't need to go into the why that content showed up. And instead we treat it with exposure and response prevention, which is the idea that, you know, the way you've been doing it is actually making it worse, not better. And so consulting with trained OCD therapists to either transfer a case over or get additional training for yourself. And of course, talking to folks at the International OCD Foundation or your local affiliate to make sure that you're actually giving clients the best OCD treatment or screening in the first place, so that you can be an ethical and helpful therapist around something that is not uncommon, but really, really misunderstood.
Thank you so much for sharing with us, Kate.
Happy to.